The moment when I found out that I was pregnant, I was very happy. But it came with a mixture of feelings, with worries and anxiety, because I wasn't sure on how I should prepare myself and my body in growing a healthy baby.
Pregnancy is an important stage of motherhood and is also an exciting time for the mothers as well. It is quite important that mother takes special care in early pregnancy, because whatever the mother does in pregnancy will impact the baby's health in the long term. So firstly, lifestyle modification is important. Try not to be in a very stressful environment or stressful state, because that can affect the growth of the baby. And whatever you eat or consume is important as well. There are certain food that you should avoid when you're pregnant. For instance, try not to eat any raw food, because that can have some bacterial contamination, and with some bacterial infection that can lead to malformation of the baby or sometimes even miscarriage in the early stage of pregnancy.
When I first got to know that I was pregnant, I visited the obstetrician in KK. I actually came to realize that my body is changing physically. My tummy was growing bigger, and my skin was feeling a bit more stretchy on my abdomen area. I was starting to have some mix of emotions. There were times where I felt very, very happy, and there were times where I was feeling a bit worried for my baby.
My tummy became only noticeable at 20 weeks, so that's when all the stretch marks appear, and I was mostly overwhelmed by this. But I have a lot of people supporting me from behind. They shared their experience, their pregnancy experience to me, so it was quite, as I listened, what they have gone through, which is what I'm going through now, so it was quite soothing for me to hear.
So during pregnancy, the body undergoes a lot of changes. A lot of the mothers may experience backache and then joint aches and pains. The first incidence of back pain can occur at any time of the pregnancy, but commonly it starts around 4th to 7th month of their pregnancy. The aches and pains can be corrected, with correct posture. So posture, like they're sitting, they're standing, how to get out of bed, even the correct lifting and carrying of their stuff is important. So for swelling of the legs, we will actually encourage them to move their legs, exercise it, and try not to stand for too long in that position. During pregnancy, one should not stop exercising. It helps you to maintain your weight, prevent your high blood pressure, also diabetes in pregnancy.
It is important that they start folic acid supplementation even before they are conceived. It has been shown that folic acid does reduce the chance of spinal defects as well as brain defects of the baby. In a mother who is older, especially above the age of 35, there's a risk of Down syndrome, which is 1 in 300. This is about 3 times increased risk compared to that of a general population. We also screen for other diseases like rubella as well as chickenpox to see whether the mother has any immunity against these diseases. There are 3 kinds of pain relief that they can choose in a hospital setting. For instance, they can actually use the laughing gas, or they can go for an injection called pethidine injection, which is on the thigh. Some of them choose to have epidural, which is the most effective. This involves putting a needle at the spine region of the mother. This will then cause a pain relief from the waist downwards and relieve the contraction pain.
My labor was a little bit different. I didn't experience the water bag breaking and the contractions coming on. For me, myself, it was an induction labor that I had to go to because my placenta wasn't really giving the baby nutrients anymore, and my girl was actually full term, so my gynae thought that it was a better decision to just bring her out in that sense.
Breast milk provides the best nutrients for the baby. Because of the antibodies found in the breast milk, the baby actually is well protected and they don't fall sick so easily.
For breastfeeding wise, I actually did up to about 8 months plus to 9 months plus. Initially, it was a full latching on, so I would just latch her for every 2 to 3 hours. But then, because she's actually a very sleepy baby, so it was quite hard for me to try to stimulate her, to get her to suckle long enough for me to empty my breast. Yeah, so and then that's when the breastfeeding problem starts to come in. You know, I had cracked nipples, I had bleeding from my nipples, and then causing the milk to turn pinkish. Yeah, so name it, I have it.
Some of the common breastfeeding problems a mother can encounter, which includes like latching difficulties, sore nipple, breast engorgement, or insufficient milk supply. There are different latching techniques the mother can use when she's breastfeeding. Modified cradle position and football hole position are ideal for newborn. This position helps the mother to have a better control during latching at the breast. There will be some mothers who are unable to latch the baby to breastfeed. She should start expressing her milk regularly every 3 hours. After delivery, mothers are encouraged to room in with their babies. Rooming in helps the mother to pick up feeding cues, at the same time allow her to breastfeed on demand.
The moment when my girl was out and she had her first cry, I just find the whole thing very surreal, you know, that I was carrying her for 9 months and finally I could see her, how she looks like. And then when the nurse and the midwife actually placed her on my chest for some skin to skin, and I just find the whole thing very amazing. I think amazing sums up the whole experience that I had. Yeah, it's just wow. Yeah.
Pregnancy is an important milestone of parenthood. However, it can be a stressful period as well, and we would like the mothers to be ready both physically as well as emotionally. Having said that, we'd like them to enjoy as much as possible with their partners for these very special moments of their lives.
It was actually a mixed feeling. Yeah. Having another human in my tummy and going through 9 months, I really did not expect to get pregnant. Neither did I plan for it, so I was partly happy, partly overwhelmed by the news, but I had my family members who actually supported me.
I called my first ultrasound when I could actually vaguely make out of a head and a body, and as each ultrasound progresses, I could actually see how my baby was developing, with hands forming, with legs forming, with feet forming, and the heart was actually beating. So that was very, very exciting for me because I know that I was carrying a little one in me.